our patient assessments, where we go through a history and vitals, we also talk a lot, especially in emergency situations, about the importance of checking breathing and checking the abdomen. Especially if there is a situation that makes us think that there could be some trauma or damage to those areas. The first one that we specifically talk a lot about is paradoxical movement. Paradoxical movement is when there is damage to the rib cage or to the lungs, and as the patient inhales, one side moves differently than the other. So rather than an inhale that fills both sides and an exhale that comes back down, we see one side move while the other doesn't. Okay? So one of the ways that we check for this is during our rapid body survey, or our head to toe, or in our clinical assessment if we feel it is necessary, is by placing the hands on both sides of the rib cage and having our patient take a nice deep breath. Now, of course, anytime we are touching somebody else, we need to make sure that we have full consent. And if students are not comfortable with this, we can have them practice this skill on a mannequin or a skeleton. But again, you're going to just place your hands on the lateral sides of the rib cage here, and then have that patient take a nice breath. And we should see our hands move evenly and go from there. The next piece is to palpate the abdomen. So again, in an emergency situation, looking for any rigidity or bloating or things that might suggest internal bleeding being done in our rapid body survey or our head to toe, depending on where we are at. And in many clinical situations, a healthcare practitioner might check this as well. But we are going to just gently take our hands and we're going to imagine that we divide the abdomen into 4 quadrants here. So I'm going to gently press down 1, right, and then come across and make sure that I am checking all 4 quadrants here, looking for any pain, tenderness, rigidity, bloating, or anything that is unexpected in this situation. Again, patient consent is really important. So even if my patient is unconscious, I'm walking through and asking those questions, and we are prioritizing that skill of taking consent with our students, and they can always opt to use a mannequin or a skeleton to demonstrate that they know this skill rather than a human body if that is not something they are comfortable with.